Williams syndrome is a genetic condition that is present at birth and can affect anyone.
Anyone?
Yes, anyone. It is characterized by medical problems including cardiovascular diseases and developmental delays and learning disabilities.
It affects 1 to 10,000 people worldwide, an estimate 20,000 to 30,000 people in the United States. It is known to occur equally in both males and females, and in every culture.
Genetic changes related to Williams syndrome. Williams syndrome is caused by the deletion of genetic material from a specific region of chromosome 7. The deleted region includes 25 genes, and researchers believe that a loss of several genes probably contributes to the characteristic features of the disorder. CLIP2, ELN, GTF2I, GTF2IRD1, and LIMK1 are among the genes that are typically deleted in people with Williams syndrome.
Common features of Williams syndrome. Characteristic of facial appearance. Most young children with Williams syndrome are described as having similar facial features. These features include a small upturned nose, long filled or upper lip bend, wide mouth, full lips, small chin, and puffiness around the eyes. Blue and green-eyed children with Williams syndrome can have a prominent starburst or white lacy pattern on their iris, and facial features become more apparent with age.
Heart and blood vessel problem. The majority of individuals with Williams syndrome have some type of heart and blood vessel problem. Typically, there is a narrowing in the aorta and narrowing in the pulmonary arteries. There is a broad range in the degree of narrowing, ranging from trivial to severe. Since there is an increased risk for development of blood vessel narrowing or high blood pressure over time, periodic monitoring of cardiac status is necessary. Next, hypercalcemia or elevated blood calcium levels. Some young children with Williams syndrome have elevations to their blood calcium level. The true frequency and cause of this problem is unknown. When hypercalcemia is present, it can cause extreme irritability or colic-like symptoms. Occasionally, dietary and medical treatment is needed. In most cases, the problem results on its own during childhood, but lifelong abnormality in calcium and vitamin D metabolism may exist and should be monitored. Next, feeding problems. Many infants and young children have feeding problems. These problems have been linked to low muscle tone, severe gag reflex, poor suck or swallow, tactile defensiveness. Feeding difficulties tend to result as the children get older.
Irritability or colic during infancy. Many infants with Williams syndrome have an extended period of colic or irritability. This typically lasts from 4 to 10 months of age, then resolves. It is sometimes attributed to hypercalcemia. Abnormal sleep patterns with delayed acquisition of sleeping through the night may be associated with the colic. Dental abnormalities. Slightly small, widely spaced teeth are more common in children with Williams syndrome. They also may have a variety of abnormalities of occlusion, tooth shape, or appearance. Most of these dental changes are readily amenable to orthodontic correction. Kidney abnormalities. There is a slightly increased frequency of problems with kidney structure and or function. Hernias. Inguinal, groin, and umbilical hernias are more common in Williams syndrome than in the general population.
Next is hyperacusis or sensitive hearing. Children with Williams syndrome often have more sensitive hearing than other children. Certain frequencies or noise level can be painful to the individual. This condition often improves with age. Next is musculoskeletal problems. Young children with Williams syndrome often have a low muscle tone and joint laxity. As the children get older, joint stiffness may develop. Physical therapy is very helpful in improving muscle tone, strength, and joint range of motion.
And lastly, developmental delay, learning disability, and attention deficit disorder. Most people with Williams syndrome mild to severe learning disability and cognitive challenges. Young children with Williams syndrome often experience developmental delays. Milestones such as walking, talking, and toilet training are often achieved somewhat later than is considered normal.
Most cases of Williams syndrome are not inherited, but occur as random events during the formation of reproductive cells in a parent of an affected individual. These cases occur in people with no history of the disorder in their family. Williams syndrome is considered an autosomal dominant condition because one copy of the altered chromosome 7 in each cell is sufficient to cause the disorder. In a small percentage of cases, people with Williams syndrome inherit the chromosomal deletion from a parent with the condition.
Certain viewers, I'm here to interview Dr. Danalie Depolio, a neurologist. Good day, Doctor. I'm Justeane Andrea Carino from Regions Network, and we're here to ask you about Williams syndrome. So, Doc, tell us about Williams syndrome.
Williams syndrome, it is a genetic condition that is present at birth and can affect anyone. It is also characterized by medical problems including cardiovascular disease, developmental delays, and learning disabilities. Children with Williams syndrome are tend to be social, friendly, and daring.
Doc, what are the genes related to Williams syndrome?
Williams syndrome associated with HLIP2 gene, ELN gene, TTF21 gene.
So, Doc, tell us about the effect of the deletion of HLIP2 gene.
A deletion of HLIP2 gene probably disrupt the normal regulation of the cytoskeleton and also affect the structure of nerve cells in the brain.
Thank you very much, Doc, for the... That's it for today, folks. Good day.